Hey, so my name is Nick Simons and this is my health assessment video. So can my patient please come in, please? Hey, can you tell me your name and how old you are?
I'm Taylor, and I'm 26.
Okay, go ahead and have a seat on the couch.
Alright.
Alright, so Taylor looks like she is clean and well groomed in a good state of health. She has even skin all the way around. She walked in with a good gait, and she's sitting here on the couch. Can you tell me, do you know where you are and what day it is and all that kind of stuff?
Yes, it is the 30th, and I'm at my house in St. Elmo.
Okay, cool. So she's alert and she's oriented. And so let's get into the assessment. Okay, so we will start with the skin, so we can only see your hands. Alright, so she has clean hands, and her skin color is even bilaterally, cap refill, less than 2 seconds. So I'm looking at her fingernails. There is no clubbing. They are the same color all the way around, and there's no cracks or anything like that. Can you flip them over so I can see your palms? So there's no lesions anywhere on the hands, arms. We'll get to the rest of that later. Okay, so let's look at the head now. We'll go from head to toe. So the hair looks clean and not wiry, or it looks very healthy. So I don't see any lesions on the scalp or anything like that. The head is a normal shape, normal cephalic. Looks even bilaterally. Okay. So I'm going to feel for the temporal artery. Alright, good and strong right there. Good and strong right there. I'm going to assess her sinuses. So I'm just going to feel right here for your frontal sinus. Tell me if it hurts when I push on it. And then the maxillary sinus is right here. Tell me if it hurts when I push on it.
Feels good.
Feels good?
Yeah.
Okay, cool. Alright, so we will go then to the eyes. So first of all, what I have here is the Snellen chart, okay? So what we will do is I will have you hold this about 14 inches away from me, which is right here. And can you read this line for me?
2843.
2843. And how about this line right here?
63925.
Okay, very good. Alright, so then I will look at her eyes with my otoscope right here. Okay, turn it on. Okay, first of all, I will check her pupil size and if they are equal, round, reactive to light. And so just look right at my nose. Okay, very active, good. They both started closing when I trying to light on them. They were both about 3 millimeters. Okay, so we will do the tangential lighting as well to check for abrasions to the cornea or anything like that. So just go ahead and look straight at the camera. Okay. Very good. Alright. Way cool. So what I'm going to do now is I'm going to assess the eyes. So what I've seen already is that her irises and her cornea and her pupils are all very clear. There's no abrasions or anything like that to them. They're all expected color. She has brown eyes, and then the corneas are very white and all that kind of stuff. So what I'm going to do now is I'm going to look for her optic disc. So what I'll do is I'll look through this otoscope and find the vessels and bring it down until I see the orange flash of the optic disc, okay? So what you will do is just look straight at the camera, and then I will find that, okay? Okay, we found the vessels. Bring it into focus. Okay, good. Found the disc. Okay, we'll let your eyes kind of adjust for a sec. And while we're doing that, I'll check the other one. But before we'll do that, I'll just have you we'll test her her optic nerve. So just kind of follow my finger. So go to the left, come over to the right, and then in. Okay, very good. So her cranial nerves that help her, I think it's 2, 4, and 6, are intact and working very well. And we already saw with the Snellen chart that her cranial nerve 1 was working as well. Okay, so I'll come over here and find the optic disc on this side. Alright, so just look straight at the camera for me. vessels. Alright, coming into focus. Alright, and there it is. Very good. Okay, cool. So before we move away from the eyes, let's see here. So I have here a cotton ball, and we'll do this. This is kind of going back to the face. So we'll assess the rest of the face before we start moving into the nose and the ears and the mouth and all that kind of stuff. So we're just going to check your cranial nerve 7. So can you open your mouth real wide and close it, puff out your cheeks, make the fishy face, scrunch your eyes real tight, open them real big. Okay, good. All right, so she has full motion of her face, and so we'll test the sensory. So what I'll have you do is I'll have you close your eyes, and I will use my cotton ball here, and I will place it gently around on different sides of her face, and she will tell me if she feels it or not. Okay? All right, so close your eyes. Do you feel that?
Yes.
Do you feel that?
Yes.
Do you feel that?
Yes.
Do you feel that?
No.
Okay, good. All right, so she has full sensory. Okay, cool deal. All right, so I'm going to change this out, and we're going to look in the ears. Okay, so before we start looking at the inside of the ears, what we're going to do is we're going to look at the outside. So can you show what this ear to the camera and the other ear? Okay, so her ears they're equal bilaterally. You can go ahead and look straight again. They are very symmetrical on both sides. There is no bumps, lesions, anything like that. This ear is pierced as well as this one, but there's no earrings in it right now. So from what I can see on the outside, they're very clean, no drainage, no abrasions or anything like that. So what I will do is I will look on the inside first. Okay? So what I'll do, just hold real still for me. I'm going to pull the pinna up and look in the ear canal. Okay. Very good. So, there is very minimal cerumen in there in that one, and I can see the tympanic membrane. It's the pearly gray. Looks good. I'll check this other side right here. Okay. Very, very good. You have very clean ears. Okay. Cool. So, inspection showed that your ears are cool. And so what I have here now is a tuning fork. So we are going to test the cranial nerve. And so, I mean, we've been conversing back and forth, so you can tell it's working already. But we'll use this tuning fork as to kind of see if one ear is stronger than the other. Okay? So I'm going to bring the tuning fork and just let me know if you hear it, okay? Can you hear that?
Yes.
How about
Yes.
that? Okay. So can you hear it more on this side than you can on the other?
No.
It's so when I ring this, it's louder in this ear than it is in this ear?
Yes.
Okay. And if I ring it over here, it's louder in this ear than it is on this ear?
Yes.
Okay. So is it equally loud now?
Yes.
Yes? Okay. Okay, way cool. And how about right now?
Equal?
Yes.
Yes.
Okay. You should be hearing it more loud on this side than you were on this side.
Okay. Yeah.
Okay. Alright, way cool. So, her hearing is intact, which we have seen kind of from our initial interaction where we can converse easily. Okay? Okay. And so I'm going to do what is called the whisper test next. So I'm just going to say a few things, okay, and you're just going to tell me what I said. Alright, so can you tell the camera what I just said?
99. Foxes?
Yep, I said foxes, because she's got foxes on her socks. Okay, cool. And from over here,
Big white dogs.
yep, big white dogs. All right, cool. Okay, so from there, we're going to look at the nose. So I'm going to pull out the otoscope as well. So this is the otoscope, and this is the ophthalmoscope, which is what I use to look at the eyes. So they're the same thing. So what I'm going to do is I'm going to have you look up for me, and I'm actually going to look inside of your nose, okay? Okay, so before we get into that, I'm going to do just an inspection of the outer end of the nose. So it's symmetrical. There's no lesions, abrasions, anything like that. It's a normal skin color compared to the rest of her body. And so, all right, so turn this guy on, and I'm going to look at this. So we're starting with the right. Okay. All right, so the turbinates are there. The septum looks good. I'm going to check the other side as well. Okay, same here. There is not a lot of mucus or anything like that, but it looks like the mucous membranes are moist and pink. Okay, so what I will check next is to see if there is a hole in the septum. The septum is not deviated, but I'll check and see if there's a hole. So the way I'll do that is I will shine a light in this one. Alright, so I shined the light into the right nostril, and I looked up into the left nostril, and I saw the glow coming through, but I did not see actual light, so that means that there's not a hole in there. Okay, so what I'll have you do next, just to test the patency of your nostrils, is can you go ahead and plug one up for me and take a big sniff? Okay, and the other one? Okay, cool. So that shows that both nostrils are patent and good airway is getting through those. Okay? Okay, so now we are moving on into the mouth. So I will put on, as I'm putting on my gloves, I'm going to look at her mouth, the outer, so her lips first. So her lips are pink and moist, no cracks, no lesions, no discharge or bumps or anything like that. Okay. And she has full motion of her lips because we saw her do the fishy face. Can you open your mouth real wide? Okay. Good, good, good. Okay, so as I'm looking at her tongue. Her tongue is pink, and there are no bumps, lesions, anything like that on them. Let's see if I can get these gloves on. Can you show me all your teeth while I'm putting these gloves on? Okay, so just from the outside, I can see that her teeth are white and symmetrical. We'll look closer later. But her gums are pink as well, pink and moist. No abrasions, no lesions on those. Let's see here. Goodness, this is taking forever. Okay. So, what I will do is first off, I will look on the inside of your mouth. So I'm going to look on the inside of the cheeks and up under the gums to look and see if I can see any lesions, if there's any ulcers or anything like that, because that's a very common thing. So open wide and say ah. Okay, cool. So I'm looking on the inside of the cheek, up at the hard palate and the soft palate. There's nothing, no lesions there. The uvula is hanging where it's supposed to hang. Open wide again. Have you had your tonsils removed? Okay, good, because I don't see any tonsils. There are the back of her throat. There are no lesions, bumps, anything like that. Looks very well vascularized and very smooth and pink. Okay, I'll look on the inside right here. Okay. Okay, cool. So everything looks good. So what I'm going to do is I'm going to take my gloved hand. I'm going to feel around on the inside of the cheek to see where the salivary gland releases into the cheek on both sides, and then also back up underneath the teeth, the outside of the teeth, underneath the gum, to see if I feel anything that could be precancerous or any ulcers or anything like that I missed with the initial visual assessment. Okay, so coming on here on this side, around up in the top, around in the front, down, around, okay, and then back on the inside of the teeth, okay, up on the top. Okay, can you stick out your tongue for me? Wiggle it side to side. Okay, lift it up. Okay, cool. So she has full motion of her tongue, and everything looks good inside of her mouth. Okay? Whew. Okay, so now we are moving on. Okay? So we've done the head. We're going down toward the toes. And so next is our neck. Okay? So can you move your neck side to side? Okay, up and down like this. Cool. We've got full range of motion. So what I will do is I will check for the carotid artery and we're feeling it. Alright, feeling it right there. And then I will come around and check it on the other side. Okay, good deal. If you can look up like that for me, we see her jugular vein right here, and then on this side, we've got the jugular vein right there as well, okay? And so inside the neck is also where all the lymph nodes are, and so they're up in the, up around the cheeks and neck and all this kind of stuff. So first of all, we'll feel the preauricular, the postauricular, we've got the submandibular, and we have the submandibular right here, and submental, and the jugulo-digastric, right there, okay. And then we have the cervical chain, the deep cervical chain, okay. And then we also have one more right here, the supraclavicular. Okay, so I did not feel any lymph nodes right there. You have not been sick these last couple weeks, have you?
No.
No? Okay, good. All right, cool. So, moving on. Let me see here. So her trachea is also midline. You can kind of see it right here. Consult my notes for just 1 second. Okay. All right, so yes, so as we can see, her head is erect, midline, full range of motion, all that kind of stuff. So now we're coming down from the neck. We're going to do the upper extremity, so we'll check her for full range of motion. So what I'd like you to do is to stick your arms straight out like this and go up towards your head, down toward the ground, okay, and then forward like this and back, and the other way. Okay, cool. Stick them out and do the old circumduction. Okay, cool. So we can see a strong range, the full range of motion. Okay, so can you go ahead and squeeze my fingers? Okay, good. Grip strength is good bilaterally. So looking at the skin all the way down both arms, so there are no scratches, abrasions, lesions, anything like that on the skin. All the way down. We already checked the hands and the fingers. So then we've looked at the arms, and we will do the chest. So what I'm going to do first is I'm going to listen to her lungs, okay? Alright, so what I'd like you to do while I'm listening, just take a big deep breath, and every time I move the bell of my stethoscope, just take another one, okay? Okay, I'm going to do the same thing. I'm going to listen to it again on your back. Okay, cool. So lung sounds are clear in all lobes, and while I have my stethoscope on still, I'm going to listen to your heart, okay? Okay. Okay, good. So heart sounds are strong and clear. You can feel the apical impulse right here. Okay, there are no S3 or S4 heart sounds, no advantageous heart sounds. And so when I listened to her lungs, I heard that she had vesicular breath sounds, which are clear breath sounds in all lobes. Okay, so what I will do now is I will we'll move down into the abdomen, okay? And so what I will have you do is I will have you lay down on the couch for a minute. Okay, cool. So, and when you lift your shirt up, just so I can see your abdomen. Okay, cool. So we can see here that, again, we always look at the skin first. So the skin is clear, no abrasions, no lesions, no anything like that. You can see that she has good chest rise with every breath. Okay, I'm gonna listen to bowel sounds. before we will, and then we'll sit her up again and we'll do the tactile fremitus and the diaphragmatic excursion and all that kind of stuff. All right, so before we get into anything, I'm just going to listen to your belly. Okay, so the bowel sounds are active in all 4 quadrants. So what I will do next is I'm going to percuss the abdomen. I'm going to percuss to see if there's any tympany in the 4 quadrants, and then we'll also look and see. We will use the hooking method to find the liver to see if there's any hepatomegaly, and then also over here on the left side to find the spleen. Okay, so we will just do the liver first. So okay, so the liver ends right about here. I know that you probably can't see it too on the video, but the liver ends right there. So what I will have you do now is I will, so I'm going to use the hooking method. So what I'll have you do is take a big deep breath in, and out, and in again. Okay, cool. So I can feel her liver right there. It feels nothing out of the ordinary. And so I will do the same over here with the spleen, so if you can kind of roll towards me. Okay. Okay, good. So you can kind of hear that it's a lot more dual right about here, which is where the spleen should be. Okay. And then just kind of cuss around, see if I hear anything I shouldn't be hearing. Okay, good. All right, so if you can go ahead and sit back up for me. Okay, cool. And so if you will sit facing this way. Okay, so I'm going to sit here behind you, and I'm going to put my hands on your back. And so what you are going to do is you're going to say pretty loudly, say the words 99.
99.
Okay, again.
99.
Okay.
99.
One more time.
99.
Okay, good. So what I was looking for was tactile fremitus, which I don't hear at all, which is very healthy. Okay, and so next thing that we will do is we will look for the diaphragmatic excursion. Okay, so take a big breath in, okay, and hold it. Okay, good. So, alright, yeah, go ahead and let it out. So I found that when on full inspiration, her diaphragm is right about here. So I will just kind of remember where that is. Okay, and so take another deep breath in and let it all the way out. Okay, so it's right about there. So we have about a 2 to 3 centimeter diaphragmatic excursion. So we'll just do it real quick. We'll check the other side. So if you'll turn around and face this way. Okay. Okay, so another big breath in and hold it. Yeah, so right about there. Okay, you can let it out. Breathe easy for a sec. Alright, and then what I'll have you do is take a big breath in and then blow it all out. And out. Okay, way cool. Okay, very good. So it looks like we have another 2 to 3 centimeters on this side, which is good because we want it to be equal and bilateral on both sides. Okay. All right, cool deal. So one last thing before we move down from the abdomen and the chest area is we, for the purposes of this video, we are not going to do a breast or a genital urinary assessment. But one thing that is good to do for teaching always is the breast self-assessment. So do you do those once a month?
Yes.
Yes. Okay. So you go into the shower when it's nice and hot, and then you do.
Check for
Okay.
Yeah.
Okay. Good. Well, she does it. So very, very good. Okay. Moving on. So we are going to go down to the legs now. Okay. So so we can see. Can you kind of put your legs up on the couch so the camera can see them? Okay, good. So her legs are the same length on both sides as well. Skin is the same color as the rest of her body. There's no abrasions, no lesions, nothing like that on them. And so we'll check your full range of motion. So raise your right leg, raise your left leg. Okay, way cool. Can you point your toes down and pull them up? Can you do that against pressure? So push them down on the gas. All right, and pull up. Way cool. Okay, and we'll check. That's sort of getting into the neurologic examination, so we'll just kind of start that as well and just kind of move around with that. So same thing with, can you put up your hands? Put your hands together. And can you push out against my hands? Okay, and then push in against them. Okay, good. All right, good deal. So while we're here, we'll also check the peripheral vascular system. So we're going to check all of the pulses. So we already checked the temporal and the carotid. So what I will do is I will check the brachial artery. That's good, strong, equal, +2 on this side, and then we'll check on this side as well. Yes, so they're equal bilaterally, and so we can also check the radial. Okay, good, equal bilaterally, and the ulnar. Okay, good. Check the popliteal pulses. Okay, cool. And then also the pedal pulses as well. Cool. So on all those pulses, I found that they are all +2, equal bilaterally, strong and even. Okay. All right. Good deal. So we've done that. So next, what we need to do is we are going to check her reflexes. Okay. So the first one that we're going to check is the one that everybody does. So if you'll go ahead and swing your legs around and sit on the side of the couch, we will check your quadriceps reflex. So yeah, it looks like the camera can. Let me see here. Yeah, I guess the camera you can sort of see better now. Okay, so what I will do is I will tap right below her knee with this, and we will see if it elicits a reflex response. So we'll go, here we are. Okay, there's one. Okay, and then the other one. Okay, and so we are going to do a couple more. So we are going to do the biceps reflex as well. Okay, so what we will do is I'm going to put my fingers right here, and what we're wanting to see is a little twitch right here. Okay. Okay, you can sort of see her fingers twitch on that one, but we'll see if we can get a better one. There we go. Okay, and then we'll look on the other side. Okay, it's twitching one finger. Here, we'll try it. Let's move down a little bit. Oh, there we go. Okay, way cool. So, we are also going to check the triceps reflex, okay? So just let your arm just hang loose, okay? And I'll hold it up right here. And so what we are doing is I'm going to hit you right here, and then this should do a little bit of that kind of reflex. Oh, there's that. Okay, and we will come around and try it on this side. So just let your arm hang, I'll hold on to it. Okay, that's good, we'll try the other one. There we go. Cool, all right. And so we will check the brachioradialis reflex as well. Okay, so what I will do is I will hold onto her thumb, and then I'm going to hit right about here, Okay? I don't know if you could see with the camera or not, but it makes the fingers twitch. And okay. And we'll do it on this side as well. Oh, there it is. Okay, way cool. And then if you can kind of sit up and put your feet up here a little bit. So I'm going to check your Achilles. So let's. Okay, so we'll put this right here. Bring your knee up like that, and so we'll do. Okay, 1, 2. Okay, you can see that her feet kind of twitched up a little bit like that. We'll try it on this side. Let's see if we can get a better angle for the camera. Alright, so we'll do 1, 2. Okay, let it bring it up a little bit. Okay. Yep, and that should elicit a response of the foot twitch. Okay. Okay, cool. So what I'll have you do now is we'll check so if you will come around right over here. I'm going to see if I can just grab the camera. Okay, so what I'll have you do is... Okay. So what I'll have you do is if you will go ahead and stand up for me. And so if you will walk just on your tiptoes. So kind of walk on your tiptoes. All right, and then kind of come down and then walk on the balls of your feet as well. Okay, good. All right, very, very good. So, and then just kind of, if you could just walk over to the stairs and back for me. Okay, so as we saw earlier, her gait is even and steady, all that kind of good stuff. All right, so we will put this back up. Okay, so as you stay standing, what we're going to do next is the Romberg test, okay? So the Romberg test, we're going to check for coordination. So what I'll just have you do is just stand super still and close your eyes and bring both of your hands up like this. Yep, and we're just going to hold it there for a couple seconds. Okay. Very good. Now what if you can bring your right hand and touch your nose with your eyes still closed, okay, and out. And then bring in, you can let it back out. And with your eyes still closed, bring your left hand in and touch your nose. Okay. All right, very good. You can go ahead and sit down. Thank you so much. So one of the last things that we're going to do is the stereognosis, okay? So you're going to close your eyes, and I'm going to give you an object, which she does not know what it is. And you are going to feel it and tell me what you think it is. Just this is to test kind of the neurologic function, okay? So go ahead and close your eyes. So I have this, okay? All right, so I'm going to put it right here in your right hand. And can you feel it and tell me what it is?
A key.
Yep, it is a key. Okay, very good. Okay, good. All right, so stereognosis. So that kind of helps us know that she has very good neurologic function. Okay, so sorry to keep you standing up, sitting down. You can go ahead and open your eyes. So we are also going to check her spine, okay? So go ahead and stand up for me. And what I'm going to have you do is I'm going to have you turn around and face this way, and then you're going to bend over and touch your toes. And I'm going to have your hands here I'm going to have my hands here on your hips just to see if one is higher than the other. Okay, so I'm going to lift up your shirt so you can see that her spine is midline, all that kind of stuff. Go ahead and stand back up. Okay, that was very fluid, very strong, and she has full range of motion. Okay, go ahead and sit back down. I'm going to consult my notes one more time, see if I got everything. Let's see here. Okay. All right, so that pretty much concludes our health assessment. Do you have any questions or anything like that?
I do not.
You do not? Okay. Well,
thank you.
You look like you're in a very good state of health, and go ahead and follow up with your doctor at least once a year just to make sure that things are also going good. And I appreciate you coming.
All right, thank you so much.
You have a very wonderful day.
You too.